AstraZeneca's COVID-19 jab won't be used on vaccinees below 60 years old, at least for now. The Food and Drug Administration says it will first look into a recent study of the possible link between the vaccine and blood clots among recipients in Europe. To help us make sense of that, we have on the phone Dr. Benjamin Ko, an infectious disease and clinical pharmacology specialist. Doc, do you agree with the FDA's move?
Hi, good evening. Well, the move of the Food and Drug Administration is in line with all of the pronouncements in Europe, no? And I think you have also South Korea that announced also that they are holding back the AstraZeneca vaccine to the younger population, and they're actually looking at a possible link, but it's still a possible link. So pending the investigation and pending all the determination, ang tawag namin doon, determination of causality, whether it's related to the vaccine or not, they are recommending suspension of the use of AstraZeneca in the younger population because they only saw it in the younger population.
Now, should it be a cause for concern for those who have already been vaccinated with AstraZeneca?
Well, not really. No, I wouldn't call it a serious cause for concern because, number one, we've had only very few people that have been immunized with AstraZeneca locally. That's number one. Number two, you need to look at the fact that there have been over 20+ million vaccines of AstraZeneca being administered already globally. And there are just less than 40 or 50 that have had blood clot problems. So I'm not sure if it is really a cause and effect relationship, but this is a signal, and the Food and Drug Administration must look into signals if there is a possibility that the vaccine can cause this. And I think some of the links that are being related to it is the fact that, number one, we're seeing it mostly in women, and number two, we're seeing the reports are mostly among women, and number two is mostly among those of childbearing age. And these are women who are also taking hormonal therapies at that particular age. And we know that female hormones can increase the risk of clotting problems at the same time. So there might be a link between certain drugs that women in Europe may be taking.
How do you think might this affect the rollout of AstraZeneca vaccines? Of course, initially, of course, it was targeted for those aged 18 and above, and that is quite a huge demographic here when we're talking about those that are below 60 years old. So how do you think might that affect the rollout, the vaccine rollout in the country?
Well, that's a good question, no? Especially the fact that there are already healthcare workers that have received the first dose of the vaccine and are expecting to receive the second dose of the vaccine, I think, scheduled sometime in June. But remember, the Food and Drug Administration just suspended its rollout. It did not say that it should not be used. So pending all other reviews, they're just suspending the its recommended use in the younger population.
Okay. Doc, at this stage, do you still subscribe to the idea that the benefits of AstraZeneca still far outweigh the risks?
Yes. Yeah. For a while, let's look at all the data for causality. It will not take them long to determine anyway if there is a relationship between the adverse events that have occurred in Europe with the vaccine. Mm-hmm. So I don't think this will be something that will take a long time for them to decide on. Mm-hmm. I think what is more important also is the fact that we may not be getting enough AstraZeneca vaccines in the upcoming months yet. So I think these are issues that need to get addressed at the same time.
Okay, now moving forward, this time around, of course, case surge still pretty much prevalent here in the country. How should families prevent household transmission?
Hi, that's a very good question. Again, I think that the most important thing is to make sure that we don't go out when it is not necessary. Number two is that once patients have signs and symptoms, to immediately isolate. So when you have signs and symptoms, you presume that you have, unless proven otherwise. It will be dengue, or it may be flu, or it may be any other viral infection. But I think the most important thing to do during an outbreak is to presume that you have, and you should isolate yourselves already. Yung hindi niyo nahihintayin na baka hindi, so lalabas pa kayo 3 sa 4 na araw, then we still go out and still associate with people, because if it ends up being COVID, then that means that you have exposed a lot of people. And I was listening to your news a while ago regarding the LGUs on the distribution of the ayuda. If you don't mind, may I make a comment?
Hey, Doc.
I strongly feel that I think it should be the LGU that should go to the individual houses instead of making the people congregate, because it places the people distributing the money are at lower risk if they go individually, rather than making the people all congregate in one area and then making them wait for a prolonged period of time.
Okay, in a way that elevates the risk, especially for those people going outside. But one other thing, you have overseas, there's been a growing trend of young adults actually getting more serious COVID. Is this something that's being noticed as well here in the Philippines?
Well, we have more numbers of the younger population getting it because they're the ones that go out. No? And then, of course, they're also the ones that decide not to isolate themselves when they have symptoms. Unfortunately, when they bring it home, they infect the whole family. So that includes all the younger children and all of the older adults as well.
Okay, Doc, before I let you go, I want to get your action on this one. You have the FDA moving to grant a compassionate special permit for Ivermectin. Your thoughts on that?
A compassionate special permit allows one to prescribe a drug for purposes that are personal to the prescribing physician. No? So, for example, if I feel that this drug can be used for a certain disease, and I want I need to have that drug available for my patients, then then the compassionate special permit route is the better route. Well, the easier route, no, not the better, but the easier route, because you don't need to wait for a long time for a certificate of product registration. So pwede mong import, tapos pwede mong gamitin, even if it is off-label. You just have to make sure that the patients understand the risks and the benefits of that particular drug. The only problem I have with the drug is that there is no fixed recommended dose for prophylaxis and for treatment. So medyo marami pang kailangan pag-aralan tungkol sa tamang paggamit ng Ivermectin. But if there are doctors that feel comfortable in using it, then I think the Food and Drug Administration has provided a pathway for them to be able to get the drug, the legitimate human Ivermectin formulation, for use among their patients. God knows we need a lot of medications now.
All right. Thank you very much for your time this afternoon. Of course, that was Dr. Benjamin Ko.